Public Health Canada's fears of COVID by paper led to ArriveScam. The pandemic agency's unscientific and superstitious fears of coronavirus contagion on paper products prompted the creation of the scandal-plagued travel surveillance app. For those of you who don't know, the flawed ArriveCan application, dubbed ArriveScam by critics, was a $60 million mandatory travel app which tracked the vaccination status of returning Canadian travelers. It was developed by GC Strategies, a company run by Christian Firth.
Speaker, the ArriveCan was supposed to cost taxpayers $80,000, but the NDP Liberal government rewarded consultants and insiders who got rich on taxpayer dollars for an app that nobody wanted. The app erroneously forced more than 10,000 people under house arrest. It didn't work, and the Auditor General said it cost at least $60 million. ArriveCan is now under 13 federal investigations. 2 middlemen that do no IT work got rich in a corrupt system under this NDP Liberal government. Some, including the witness today, became multimillionaires. GC Strategies is a two-person company, and they claim to find people who actually do the work by using LinkedIn. Nearly $20 million for ArriveCan is what they were paid, and roughly $2,500 per hour. They've been paid $100 million since forming GC Strategies just after this Liberal Prime Minister was elected. This is 8 years of this Liberal Prime Minister. The Liberal government has been ordered to collect and recoup all funds paid to ArriveCan contractors and subcontractors that did no work on the ArriveCan app. My question, Speaker, has the government asked Mr. Firth to repay the money paid to GC Strategies on ArriveCan?
Mr. Firth. Mr. Speaker, no, they have not.
ArriveScam is now the subject of multiple police investigations into deleted records, wrongfully awarded and inflated contracts, contracts with no work for payment, and internal corruption at the Canada Border Services Agency.
Commissioner, you referenced in your opening statement multiple investigations into these matters. Is this in reference to the ArriveCan issue?
There are multiple, correct, Mr. Chair, there are multiple investigations going on.
How many in total, officer?
I'd have to refer to Mr. Flynn and see if we'd have an exact number, but numerous.
Can I get an exact number?
So with respect to this type of activity, there's a broad number of investigations specific to ArriveCan. There is one investigation specific to ArriveCan.
So one general investigation and offshoots from that investigation?
Not offshoots, but if you look at the ArriveCan as well as other similar types of situations, there are many is the category I would put in. I won't give us an exact number.
Many. So more than 6?
I'll say yes.
Yes.
So that would be as precise as I can get to.
And is this in reference to contractors and subcontractors, or does it involve federal bureaucrats, and or does it involve government officials?
Specifically, I'm speaking to procurement irregularity investigations.
Okay. Again, the question put to you, is this exclusive to contractors and subcontractors, or does it involve government officials?
It involves the entirety of what needs to be looked at with respect to procurement contracts.
And I take from that the entirety could include contractors, subcontractors, the federal bureaucracy that dealt with those contractors, as well as the deputy ministers overseeing that department, and ultimately the ministers of the Crown who have ultimate responsibility. It's a catchment of individuals that potentially you're going to be looking at. Is that correct, sir?
I will not speak to any information with respect to the targets or subjects of the investigation. I will simply speak to the substance of it to give you as much information as I can today to be helpful.
Thank you, sir.
Documents obtained by Blacklocks reveal that a COVID hysteria conspiracy theory about the virus living on paper paved the way for the waste, corruption, and human rights abuses of ArriveScam. According to Blacklocks, the Public Health Agency, in an in-house memo, says it introduced the $59.5 million ArriveCan app because it feared ordinary customs forms were infected with COVID. Early in the pandemic, before the transmission vectors of COVID were well understood, there was a suspicion that the virus could live on and be transmitted via the paper forms, said the memo, Benefits of ArriveCan. But here's the kicker. The public health agency doctors never claimed COVID-19 was transmissible by paper. I am not quite sure what the risk would be. Dr. Howard Nadeau, Deputy Chief Public Health Officer, told reporters March 23, 2020. The risk is not really out there. There should be no chance of interaction. Managers never identified the source of their paper germ theory. Jonathan Moore, a Canada Border Services Agency Vice President, testified April 3rd at the Commons Public Accounts Committee that an unidentified expert told managers that paper forms were unsafe. A lot of individual border services officers were very reluctant to touch paper because the public health agency had said you can catch COVID from touching paper. So the necessity to get a paperless process in place was really important, he said. All of this would be funny if all this hysteria didn't cost Canadians $60 million and counting. For Rebel News, I'm Sheila Gunn Reid. Blacklocks did the heavy lifting here to make this report possible. However, Rebel News does dozens of independent access to information filings every single week. To support our research and filing costs, please consider making a donation at our special investigations website, rebelinvestigates.com.